about sensory integration is even, when we've come across a case and you think you see how it's going to go, and then you're not getting the results that you expect to have. And you might come along and do a sensory assessment and be able to tell me all this information that I would never have known and I would never have looked for as a nurse. And you might then treat the person with, different kind of interventions and techniques and get results. And it's just so amazing to think that if we had never looked at that person, through this lens, we would never have seen these needs and been able to make these changes. So it's really just kind of like broadening, the whole perspective of what's going on with an individual.
From my perspective, as the person coming in with my sensory lens, I really can't overstate the importance of having MDT involvement, because as we all know, no one practices as an island. We all work together, and realistically, we're all looking at the same person. So having colleagues that are open to trying new ideas or, a new approach that perhaps they wouldn't have had exposure to before, it's really, really of benefit to the client, because it means that they're getting consistency. And as we all know, with a lot of our clients who are distressed, consistency is one of the things that can really, really help with the level of distress that they're experiencing, if everyone is kind of on the same page and saying the same things to them.
I think that's what I found as well, that there might have been things that I was trying to advise that weren't necessarily helping the person. But then after, I suppose, them being looked at through a sensory lens, you could see that there were some adjustments, and sometimes they're just like adjustments to a technique or a change in an environment or something, and that kind of provided the base then for other interventions to work.
The base is the bit that I always emphasize. We're not trying to say that this is an intervention that standalone will sort everything out for a person. Very generally it won't, but what it will do is it will provide, almost like the foundation of a house, it will provide that base for the person on which to build other interventions. And very typically, when someone is more regulated from a sensory perspective, they're then more able to actually engage in the treatment that has been offered to them that maybe they previously weren't able to deal with, or that they weren't ready for.